Hi guys, Dr. Axe here. In this quick video, I'm going to tell you everything you guys need to know to overcome low back pain and sciatic pain. And you're going to learn exactly why you're still in pain and the missing links you need to do to overcome it. And this is really an epidemic. 635 billion a year is actually spent on pain. That's more than cancer, heart disease, and diabetes. So clearly we're not figuring this thing out. So today in this little video, we're going to go over why you're still in pain. What are the missing links? Okay, and there's 3 missing links. You have not addressed the 4 different tissues that control joint pain. Most people are only treating the muscle or the joint. They're not treating all 4 tissues. They might treat 3 out of 4, and then you're not going to get the results that you need. Okay, posture is important. Okay, if you don't work on the posture, you may never get out of pain. You cannot skip over that one. And the third one, if you don't reset the nervous system, those pain pathways, you could fix the problem, but still have back pain and sciatica because you didn't reset the pain receptors. And the second thing we're going to cover is the 3 big causations of joint pain. One of them is systemic inflammation. And that's why at our clinic we do specialized inflammatory blood markers to figure out if there's a food trigger, a deficiency, maybe a toxicity causing the inflammation in your back and around the sciatic nerve. Okay, we're going to talk about neuromuscular dysfunction. And thirdly, joint tissue damage. Okay, so really, if you don't have motion in that joint, it's going to cause pain, or you impinge a nerve, that's going to cause pain. Okay, so again, we're going to cover those 3 things here quickly on this video, so you can figure out how to finally get out of pain. So let's talk about posture. They found that when the body shifts forward an inch, it adds an extra 10 pounds of compression on the spine, and that leads to muscle strains, disc herniations, arthritis, and pinched nerves. That is just from a change in posture. So at our clinic, we always work on the posture. Again, you could do everything right, get adjusted, do physical therapy, stretches, surgery, but if you don't change the posture, that might be the missing link for you. So it's so important. This actually study here, I'll just abbreviate it for you, found that if you lose the structure or the curvature in the spine, it actually compresses the nerves and the blood vessels around the spinal cord. So that's something we always pay attention to on MRIs and X-rays, and we always treat our patients to get that curvature back. Okay, so again, if you don't work on the posture and you don't get the curvatures back in the spine, you're never going to get out of low back pain and overcome sciatic. So let's talk about the second cause of chronic low back pain, and that has to do with neuromuscular reeducation. So again, if you don't reset those pain pathways in the spine, you could do all the right things, but you're going to continue to have pain. And through something called vibration therapy, there's a specific frequency that actually re-educates your muscle memory and can actually reset those pain pathways. They found out if pain is there for more than 30 days, it literally changes the neuronal pathways, the electrical impulses. So at some point, it's not a physical pain, it becomes more of a mental pain. And through using some key technologies out there, such as vibration therapy, we're able to reset those pain pathways in the body. So, when we're doing an exam, you have to find all the different things that cause chronic pain. So when I do an exam, I'm going to look for misalignments, okay? Because a misalignment is going to cause arthritis and it's going to damage the joint, okay? The second thing we need to look for is scar tissue that's restricting motion. So, and this is, how we talked about, you have to address all the different tissues in the joint. And if you don't break up scar tissue, the joint will not move inflammation will build, and that will impinge on the nerves in your low back pain, specifically the sciatic nerve. Okay, when we're doing an exam, we need the right imaging to find impingements on the nerves. If you impinge on that nerve, that is going to cause a lot of pain. Okay, and the fourth thing in an exam that we need to do is we need to pinpoint where systemic inflammation is coming from. Again, you could do all the right things. You could correct the spine, get pressure off the nerve. But if you have inflammatory chemicals in your blood surrounding that nerve, again, you're always going to be in pain. So this isn't just a low back sciatic problem. This oftentimes can become systemic. So when I'm doing an exam on a person, I want to make sure I'm also ordering the right tests, blood work, etc., so that there's not an inflammatory component that we're missing. So with that being said, what is the solution? We talked about the 3 causations of joint pain, and we talked about the 3 biggest keys that people miss. One being they don't address all the different tissues. Secondly, they do not reset those pain pathways. Okay, so what is the solution? You have to address all the different elements. If you just address half of them, you're not going to get the pain relief that you're looking for. So the solution is addressing all the different tissues, addressing all the different causations. Okay, and the reason that we're different and we're able to get results where other offices aren't is because we're not skipping pieces of the puzzle. So that's why we use things like postural correction techniques. We use trigger point injections to alleviate muscle pains. We use vibration traction to help unherniate discs. We use low back decompression to help unherniate discs. We use different spinal orthotics and bracing to actually remold the entire spine to get those curvatures back and change the posture. We do physical therapy, but we use x-rays to actually guide us so that we're working more specifically on that individual. Spinal manipulations, that's to get equal motion in those joints and reset those the proprioception of those joints. We use neuromuscular reeducation or vibration therapy to reset those pain pathways. Again, this isn't just a spine thing. It's the whole neurological system needs reset, and that's what we use. Functional medicine testing to look at inflammatory markers in the body. And we even use something called PEMF technology that actually decreases inflammation almost as much as a steroid without all the side effects. And there's, again, no side effects, and it helps get people out of pain in as little as 8 minutes.
Hey, well, I want to tell everybody that before I came here, I was using a walker, and I stumbled in the door with a cane. These guys have got me walking good. I can now bend over and touch my toes, which is a great thing. And I threw my cane away about 3 days ago. I'm now walking without one. So I'd like to say that these gentlemen can really help you, and you need to come and see them.
So, yeah, really cool story. And the guy, again, he had surgery. He was in chronic pain. The doctors at that point didn't even know what to do with him. They said just take some pain medications. And again, we don't know what to do. And this was actually his MRI. You can see that red arrow right in the middle of the screen. The disc was pushing into his spinal cord and causing sciatic pain to the point where he couldn't walk. And again, the doctors had completely given up on him, and we were able to actually fix this herniated disc in his spine. This was his hips and low back from the front. He had a scoliosis on the left-hand side here. You can see this curvature over here to the left, and then on the right, on the red, completely straight. So again, he had seen these doctors and tried all these things, but no one actually fixed the structure of his spine, and that's why the surgeries didn't work, and he was still in pain. So again, we addressed all 4 tissues in his spine. We corrected his posture, we reset his neurological pathways and reset those pain receptors, and that's what made a huge difference for him. So next steps, we accept all insurances. So a lot of people just have to pay their copay. You really have nothing to lose, everything to gain, and we'll call you within 24 hours, and we'll find the office closest to you. And anyone that shows up into the clinic, we actually have an online course where you can learn all the steps I went over today on an online course. And just for showing up for your appointment, I'm going to give you that entire online course and material. Thank you guys so much for watching. And, it's really our heart and our mission to help people that are in pain. They've tried everything, and it ruins your life. It's debilitating. And so please give this a try. Again, you have nothing to lose, and I really, really hope we can help. And I look forward to seeing you guys. Thanks.